And first, I'm going to do just a brief overview of MQ-SUN, tell you a little bit about our project. And then my colleague, Monica Kakari, is going to talk a bit about the work that we've been doing with the SUN Secretariat. We've done some work in the past this morning, but we're also in negotiations with the SUN Secretariat and DFID to continue working with them over the next year, and we'll talk about that. And then, of course, we have Hellen Connolly, who is here to present on the work that she's been doing through MQ-SUN for the SUN Secretariat and the SUN countries about costing. And Hellen is with ICF International in their Atlanta office. And last week she was in New York. She participated in the UN event there and made a presentation about the work she's been doing with MQ-SUN. And so we're very pleased that she could come this week to DC and share that same work with us in our in the DC nutrition community. So welcome, Helen. Let me tell you a little bit about MQ-SUN. The project name is actually maximizing the quality of scaling up nutrition. This is a DFID-funded project. Some people call it DFID. It's the Department for International Development for the government of the United Kingdom. We are about 18 months into a 4-year performance period on this contract. Our mandate is to provide technical assistance to the DFID UK office and the DFID country programs. And we covered 2 areas. One, we're to help them strengthen their ongoing nutrition programs. And second, we're to help them integrate nutrition into some of their other sectors. And those sectors include poverty reduction, education, health, and of course, agriculture. We have 8 organizations working in partnership on this project. We have 3 U.S. partners, we have 3 UK partners, and then we have the Aga Khan University in Pakistan, and PAP is the prime. As I mentioned, MQ-SUN provides technical assistance. We do short-term and long-term technical assistance through a mechanism that DFID calls call-downs. Here in the U.S., we would call them task orders. So this work includes nutrition audits. We write business cases. Business cases are a mechanism and a process that DFID uses to develop their new projects. So we help them design their projects for nutrition. And we've started about 5 of these so far in the life of the project. And just about all of them have been about integrating nutrition into their other sector programs. We also work in knowledge management and dissemination. One of our partners, IDS, is the Institute for Development Studies, and IDS publishes a nutrition bulletin. And so they have been working in 2 of our countries, Zambia and Pakistan, on a special edition of the IDS bulletin. And so they actually invited local nutrition researchers to have their work published in a peer-reviewed journal. We also do operations research. We work in impact evaluation. We're doing an evaluation now in Bangladesh. We're evaluating the integration of nutrition into 3 of DFID's poverty reduction programs. and that's ongoing. We also do operations research, I think I mentioned that. We do governance and political economy analysis. We do capacity building, and of course costing, which Hellen is going to talk about this morning. And we do work in financial tracking. We just finished an assignment for the Business Network at the Sun Secretariat, helping them develop a tracking system for the funding commitment that they got during the nutrition event in June in London. And so we're going to continue to do some work with that Business Network. So that's in Sun in brief. And so let me introduce Monica Guitari. Monica is the nutrition advisor at the DHS. She is seconded from PATH to ICF International, and she does nutrition data analysis and writes special reports for USAID. She's a very busy woman because she's also the senior Sun M&E advisor, and as part of that work, she oversees our work with the Sun Secretariat. So, Monica?
Thank you, Didi, for the kind words. Good morning, everyone. So I think I'm just going to tie the overall Sun work to the costing work, how it all started, and give you a brief history about the work that we were already doing and how it ties to the costing work that Hellen, costing work that we are doing now, providing support to scaling up nutrition secretariat. So as part of the Sun core activity, we were reviewing national nutrition plans of 17 different countries which are listed down there. For doing this review of national nutrition plans, we developed a standardized checklist tool so that this analysis could be done in a standard way. Based on this checklist tool and analysis, we prepared summary documents of these 17 documents about the review. At the same time, Sun Secretariat was doing the costing work, and they were costing nutrition plans for the country. So these two kind of work, and then we received requests from Sun Secretariat to do the costing work. So these two were kind of tied in well together, and so we could take the review of the national nutrition plan forward. So that's what you are going to hear from Hellen today, what work has been done and how the analysis works. So this request, we kind of broke down into different phases of the work. So this is how part of the work came, but we kind of were operationalizing them in a logical way. It was divided into phase 1, phase 2, which has already been done, and phase 3, which is going to come forward. So I'm going to talk really briefly because Hellen is going to go into details about phase 1 and phase 2 work. So as part of supporting scaling up nutrition secretariat in phase 1, we did the costing of scaling up nutrition desk analysis for 16 costed scans. The result of this phase 1 work was presented in Brussels, Sun meeting in Brussels in March, and I believe Hellen is going to present the results for that as well. The partners for this work were ICFI, HPI, coordinated by CAP. It was about 2 months long, which took us to phase 2. And one important task that was done in phase 1 was development of the costing tool itself to do all of this work that has happened and is going to happen in phase 3. In phase 2, there were country visits that happened for pilot testing the tool that was prepared in phase 1 of the work. There were 8 country visits that happened in Nepal, Bangladesh, Indonesia, Sierra Leone, Burkina Faso, Madagascar, Malawi, and Rwanda. There were continued desk reviews for the costed plans that Sun Secretariat received in that phase 1 period and so on. The results of both phase 1 and phase 2 were presented at the DA Nutrition Rules for Event that happens in June in London. Again, this work was implemented by ICSI and HPI coordinated by CAP. There, next one. So these two phases laid the foundation of phase 3 work that we are going to undertake starting hopefully next week or moving forward. And this would be to provide technical support and assistance to the Sun countries via scaling up nutrition secretariat to accelerate action to tackle childhood undernutrition. And the areas of support that are expected to be provided during this phase include review of the policy legislations and develop nutrition plan summaries for scaling up nutrition countries, organization and implementation of a common results framework based on countries' action plans, financial tracking, aggregating and documenting the lessons learned from the previous phases and this phase and disseminating the work. And this would be a long-term phase for about 12 months, unlike the previous phases that were like comparatively shorter. So without taking too much time, I would like to introduce our guest speaker today, who has done most of the work or coordinated most of the work that were done in phase 1 and phase 2 and share the results of these work and the results that were presented at the Brussels meeting and scaling up nutrition growth event in London. So before I call her, let me introduce Dr. Connolly. Dr. Hellen Connolly, as Denise already mentioned, is a senior economist with our NQ-Sun partner ICF International based in Atlanta. Dr. Connolly has a PhD and master's degree in economics, master's in public administration and education policy, and bachelor's in economics and psychology. So she has done economics a lot. She has over 20 years of experience providing her expertise in this health economics field, working in the area of nutrition, HIV, smoking cessation, and chronic diseases like cancer and heart disease in multiple countries. For most recently, for NQ-Sun, Dr. Connolly has been the lead evaluator for the NQ-Sun costing work for the Office of UN Special Representative for Food Security and Nutrition, which is also called Sun Movement Secretariat in short. In this capacity, Dr. Connolly oversaw the harmonization of the Sun country costed plans and evaluated the cost of scale-up within and across countries. Additionally, her work also involved estimating the gap between necessary resources and committed funds available for scaling up nutrition. So I'd like to welcome Dr. Hellen Connolly to share the costing work for scaling up nutrition and lessons learned during the process. Dr. Connolly, thank you.
Let me add to my resume a little bit. I'm actually a labor econometrician by training. Most of my early work is on poverty and inequality, looking at labor markets across the world. I worked at the Luxembourg Institute study, harmonizing data. So I have a lot of experience with data analysis, with lots of different types of data sources, investigating what's behind the different data sources, and that's been very helpful in looking at these different costing plans across these countries. To tell you how addictive this project has been, I actually started 2 weeks ago working on my certification for nutrition in development from Tufts online, so that I can get some background on what I'm doing. So I've come into this project from doing costing on HIV work in Africa, and the nutrition movement has just really galvanized me. It's been very exciting work. So Monica already talked about the different phases, but I'm going to just go over a little bit of more detail about what it is we were doing. So phase 1 was a policy review. ICF was not involved in it at the beginning. That was the HPI and past work, and then from that I got my 24-hour. This is the Lancet series. This is nutrition, and this is how nutrition works. To try to put together an analytical framework for taking these costed plans and moving them into a more cross-comparison arena. So this is just an overview of what we're doing. I'll go into a little bit more detail. So on the next slide, in phase 1, there was a policy review, and then we started looking at just developing an analytical framework. So we developed what we called an aggregated cost tool, because we all like acronyms, so we have the ACT. And it was a way of looking at, at the time we had 12 plans that we started with, we were looking at what were the commonalities? How can we look at these things so that countries can learn from each other? We do want to make sure that the country differences are incorporated, but how can we look at this in a broad scope and say what's happening out there in the world of the different priority countries or economies? And we also were looking at a methodology for sort of doing this cross-country review to get more information about what's happening within the country. The next slide. The aggregated cost tool, like I said, is we tried to find all of the pieces that were involved in all of the different costing plans. And so we looked at, the program description was something provided in the plan. So you have a task. Normally you'd have a strategic objective, you'd have activities, you'd have interventions. Sometimes it would go down to the individual task level, and sometimes it would go down to the input level. Each one of these plans provided a different variety. Sometimes they just knocked it out like objectives, sometimes they went down to extraordinary detail. The program classification is the system that what we sort of is a framework overlay on top of these plans to help us look at these in a more standardized way. And then the target groups, where they were provided in the budget, in the plan, what population are you trying to reach? So we look at targets both in terms of the immediate population target, so is that the number of teachers you're trying to reach or the number of children you're trying to feed? And then also the objective target, the reduction of malnutrition by 30%. We identified the lead budget holder. That told us a lot about how the money was being funneled through the country and into the population, so who was in control of the money. And then the annual plan costs. And where possible, in many cases, within the plan itself, the secured funding was also there, whether that was government funding or external sources. And so the funding source, we also looked at the funding sources. We did a lot of overlay mapping about what sources were coming into the plan, so I'll talk about that. So the next slide. We were looking at visiting the different countries, because the Sun Movement Secretariat has selected a number of countries that they thought could benefit most from a visit, whether that was to help them disseminate their plan across multi-sectors, or whether there's a specific issue that needed addressing, like matching up the M&E framework to the cost, or whether it was trying to establish costs. So we were looking during the visits to figure out exactly who was involved, not only on the plan itself, but involved in creating the plan. Was this a government only exercise, or were they bringing in stakeholders from all over to help develop the plan, figure out what the M&E framework is, and figure out what this common results framework should be, and how the different sectors feed into that. We were looking at how costs were calculated. That could have been based on previous budgets, where they have a project budget, and they said, okay, it costs this much to distribute by M&A capsules. It could be, like I said, detailed, what staff were involved, how many trucks, what facilities, all of these types of things. We looked at how the different targets were selected. So is this population target based on the neediest district? Is this a national plan? How are they looking at scale up? Right? Are they looking to do pilot studies and expand, or are they talking about going into the country and doing these projects all at once? We looked at how the donor networks were involved, whether they were involved in the planning phase or whether they were just brought in later. And then where we could, we worked on some financial mapping, because sometimes we would get information about what the donors were providing, and then we helped map that to certain line items in the budget. So some of it might be nutrition related, and some of it might not. I mean, a lot of these were maternal and child health. And so we tried to figure out what portion of that was really going towards what was listed in the nutrition plan. So not making a judgment about which is nutrition, which is not, but given the activities that we were told, how do they map up, how do they line up with the things that have already been identified as priorities by the countries themselves. Next one. So all of this led into, once we had this beautiful picture of how we're going to standardize these very disparate countries, and had a methodology for going in, we went into phase 2, which had 3 different components. One was the continuation of this desk review, looking at all of the countries as they were coming in. As I said, we started with 12 countries where we had the plan, but as we're working on this, we're getting more and more countries every day, and there was feedback and some back and forth about how classifications were designed, and so it was a continuing process. There's targeted support, which is those country visits. What can we do? Where can we go in and do the most help? And then international events. Monica already touched on those, the Brussels senior level meeting and the UN Sun Global Gathering last week. Next slide. So the depth support, the cross-country review of what ended up being 21 countries, 20 of which were costed, putting them into this standardized framework. We reviewed the plans across the different categorizations, which I'm going to go into detail in a minute, to see how the countries were playing out, why there might be a larger budget in one area than in another area. So just to get a big overview. Like I said, we incorporated the feedback. We put the plans into the standardized framework, went back to the countries and said, here's how we saw, this is what we saw in your plan. Can you just verify that we interpreted this correctly? In some cases, because we have these details, we actually have a very detailed classification system, but the budget or the plan item itself is something very large and vague. So we looked at it and said, oh, that looks like government, but it's actually multiple components. So once they come back and say, oh, no, this is really more of this, this, and this, so we could do some reclassification. But also it helps them to say, well, what does this task involve? What are we looking at? And so in many cases, they separated that out so that they could really see how do these sectors interact and what's involved in actually implementing these tasks. So it was a really good back and forth process which helped us understand what was going on in the countries, but also help the countries understand what it is they have to do to actually put these interventions into motion. We looked at what was, how things have changed over time, how the budget, how they're looking at the plans for scaling up. And so that might be, in some countries you'll see that there's a really heavy nutrition-specific sector, and that tends to be countries that have really high rates of crisis malnutrition problems. And then you have others that are a little more advanced in solving the crisis situation, looking more towards nutrition sensitive and government. We looked at the external funding where we could, and then we prepared documentation for Brussels meeting. It all countries. So we put together some drafts that you'll see that are country specific, where the National Planning Commission could go to the different ministries and say, see how we're supporting nutrition. See how your part fits into supporting nutrition. Are we missing anything? How can we work to meet these objectives? So they're using it to sort of build their common results framework. And so that's been an interactive process as well. So, next slide. Also, as looking, we're trying to envision the next step, because really the ultimate goal here was, what do we need? What's the funding gap? That was the big question we kept getting from DFID. Tell me what the funding gap is, who needs what money, and what would they use it for, what are their priorities? So what we tried to do in looking at the plans themselves is where we could identify the different contributions. We put those in. We have set up a framework that shows where we do have information, where the gaps are, so that going forward we have a much better idea of what the missing pieces are in order to figure out what the gap is. But we were not very successful in those cases in identifying the gap itself out of the plans that currently exist. But we did work with, when we went into the countries, we did work with the donor organizations to try to identify how to map these into the plan, to learn also about, in some places we went where the donors were not involved in coordinating the efforts in the plan. We also brought that information to the ministries and to the planning commission. That, okay, you've got these donor organizations who are doing X, Y, and Z. This is not in your nutrition plan. And a lot of times we said, oh, we didn't know they were doing that. So it gave them a better idea of looking at how these external resources are coming in, and maybe can help them learn how to adjust the plan. If the money's coming over here to do vitamin A supplementation, then you don't really need to be planning for that necessarily. I mean, in year one, and hopefully, over the years that would all go through the country. But just to have an idea of what's happening, how do these things map together? So we did a little bit of that communication within the country. And then we also assisted the Sun Movement Secretariat with specific requests for different meetings that they were going to say, look, we're looking at regions, we're looking at, what are the top countries in nutrition-sensitive approaches, and so we would put together some different graphics and things for them to kind of sell what's going on, how is the movement changing, and which countries are participating. Next slide. So our targeted support, this is the country visits. We actually count 9 countries rather than 8. Because none of the Sun Movement Secretariat staff went into Mozambique and did his own, can the Sun Movement do this as well? And it was the same framework. So the selection of countries was actually within phase 2. There were 2 phases. There's the first grouping, which was, let's take a look at what's working. Find out what it is, where the plans are more complete. So we looked for countries that had a nationally ratified plan. We wanted to make sure that the focal point was fully engaged, not only in the movement, but in our visit, because in some places there was just an overwhelming amount of information that was being requested in this, so we don't want anybody here now. We're busy doing everything. My daughter tells me that I'm too loud. So we also were looking for how the portion, there's a large portion of the budget going towards nutrition. So there's some indication that nutrition is a high priority or is gaining priority in the country. And then for that first group, we're looking for, high quality is not really the right word here. It was really, was there a multi-sectoral approach? Were there a lot of stakeholders involved? Was there coordination of efforts? So it was really more about trying to find where the process was developed more than the plan. The second group was really targeted towards the June 8th, the pre-G8 summit, which was where can we go in and provide technical assistance to create the biggest bang, right, for the time we have, so that they can present their plans at this donor event to try to gain funding. So the second set of countries was chosen for that. So they're really quite different. The first ones were much more developed, and the second ones were in a lot of ways not. So we went in to talk to the focal point. We said, okay, here's what the aggregated cost tool is all about. This is how we are reframing things to look at nutrition plans in a slightly different way outside of the Ministry of Health context into the Common Results Framework context. How does your country fall in line in your national plan? And like I said, we worked a lot with the ministries, the Planning Commission, and the donors to try to link them together where they weren't communicating. To say, we went to some donors and said, okay, well, how do you fit into the national plan? Because we have a national plan. So there's lack of communication on both sides in many places. So we did work a lot with that. We looked to understand how these plans were being, how the costs were being estimated. So in some cases, like I said, it's project specific. Sometimes it's very input specific. In most cases, they're looking at marginal inputs. So you'll see in that the nutrition plan, because of some of the politics of the budget across these ministries, when they say, okay, now we have a nutrition plan, they're like, well, we don't want to give up our money from over here. What we saw a lot of was anything above and beyond what they're already doing. They'll say, okay, well, we get extra money, we'll do this project on nutrition, and then that got added into the plan. So we talked a lot about not that this was a separate ministry. It's not the Ministry of Nutrition. It's really, here's this Common Results Framework. This is what we're trying to achieve. And the ministries are showing us, highlighting, right, this virtual mapping through this overall nutrition plan, show us how what you're doing is supporting the nutrition movement. So we're not taking away, we're not trying to redistribute, but just show us how these different ministries are contributing to scaling up nutrition. And once they started looking at it in that way, and not as the, there's no money going, there was a lot more communication. And we found that it was very helpful in the interactions, just in the ways that they're framing it. So we did look at the individual contributions of the donors of the ministries. We talked across, in some cases we went to new sectors where we're looking at education or religious affairs. How are they contributing? We also were asking about, because every one of these countries does have a funding gap, the donors were asking information about, well, if we do provide money, where is it going to go? Where in this list of 50 million tasks is this money going to be distributed, and how? So we talked a lot about funding mechanisms, and where we could, we identified where the financial gap actually existed. Next slide. And then the international events, we already discussed. The Brussels meeting was really it was a high-level meeting of where are we going and how are we coordinating and what is it what are we looking at? Where are these countries? What do they know? How far has the planning process gone? So we did a presentation there talking about the countries that we had already, for the desk review, this was before the country visit. And then the pre-G8 meeting really was less of a presentation, more of we helped provide these two-page documents that said, here's what our plan entails. Right? These are our priorities. These are our commitments, the government commitments, and here's our need. Right? And so a lot of the second phase of country visits was really trying to identify how to show what the need was and where the priorities were and where that money would go if they got the $4 billion that was committed. So these are the countries that we were actually looking at. There were 20 countries. The red ones are the ones we visited. You can see there's a wide variety in region and plan intensity. Most of these were 5-year plans. Some of them were 3-year plans. In some cases, there was a 1-year plan. But we took whatever the country gave us because it's all about building the capacity and building the discussion. And so we were taking whatever plans the country had ratified. Looking for ratified plans. Next slide. So I'm going to take a look at the overall, just kind of an overview of the 20 countries that we did investigate. And I'm going to be looking sort of a couple of caveats about how you look at these when you're talking about comparisons, because there really is no comparison. I mean, every one of these countries is very different in the way that they've developed the plan and what's involved in the plan and how they estimated the cost. It's really looking about reframing this in a way to get the discussion going about the common results framework and getting the partners involved to try to build to this, our goal of eradicating malnutrition, right? So I'm going to just show you some results. I'm going to talk a little bit about some messages that we got when we were in the countries, but also the meetings, the global gathering last week, and then a little bit about phase 3, what's expected there. Next slide. So each of these national plans really is, they vary based on who the players were. Right? In some cases, you'll see something where it just really looks like a Ministry of Health budget. And in other places, you'll see something that's really a coordinated effort among all the partners, all the ministries. And so you'll see very different approaches and results depending on who was at the table during these discussions. These are all national plans, except for the one actually that changed during our visit, and they completely dissolved their plan because they are budgeting their districts, and they had district plans, and they said, okay, we'll scrap everything we did on the national one, and we want to put all the districts together, which was quite a feat because there were hundreds of them. So we put all the district plans together. So Rwanda is actually based on a district level costing, whereas these other ones are more national oriented. And that, so it's really, these national plans are a reference, right? This is what we want to do to eradicate hunger across the country, but these countries have extreme diversity. I mean, we're talking about Nepal and Indonesia, where the capital city and the outlying districts have different needs, have different problems, and have some different ways of supporting the community. Right? And what you hear a lot of is, how do we get the community involved? How do we get this? This has to be from a community level effort. So while these national plans reflect the commitment on some of the issues, the discussions are now more about how do we get the districts to plan, to be involved in the planning process, but also in the cost process. Because costs also vary. You can't say that it can really work here might be volunteers, and here might be medical costs. So there's a wide variety within the districts themselves. Next slide. So some big differences. What we saw was what's included, but specifically what's not included. So what we see are missing in many cases are existing personnel, existing facilities. So they say, oh yeah, well it's already part of our budget. But it's also part of the cost of implementing this program. And if you're going to go out and talk about the country level commitment, you've committed, I mean, these people are, that's already absorbed into the budget, that is a commitment. And you really need to be showing, this is the cost of implementing this program, the whole cost of implementing this program, and we're already committed to 90% of it, and we just need this little bit. That's a better sell than saying, okay, well, here's we need $2 million, and we put in $20,000. So those pieces are missing in most cases, and it makes thinking about scale up a little bit harder, because the first year plan is normally it's a small scale, right? And so they're thinking about what can we do with our existing personnel, and what projects or pilot projects or some really small scale increase. And so when you're thinking about actually scaling up to eradication, right, you're going to have to add more personnel. You have to think about that. And if you haven't planned that in, then that makes it difficult to think about scale up, because you're not going to be able to scale up to 100% with existing personnel. So we had some discussions about how that might get included. The new versus existing interventions, like sort of talked about, like in a lot of the ministries, they would say, okay, well, this is already in our budget, so a new project, okay, we can build a well in this district. That's a new project. We'll put that into the nutrition plan, because that's not already in our existing. And the amount of involvement from the different sectors and the different stakeholders really set into how these plans differ. Right? If you have a big multi-sectoral approach, you're going to see a lot more nutrition-sensitive stuff. If it's primarily a Ministry of Health budget, right, then the plan is going to show up as being much more specific intervention. The scale-up assumptions were very different. So when you see this increase over 5 years, in some cases they just said every 5 years, that was the same. You didn't see any variation across the 5 years. In other countries, they would vary. How are we going to expand these programs? So we start with, in Nepal, they have 6 district pilots, and then they're going to add 12 more districts. And so they had a very defined scale-up, and that's reflected in how they create the 5-year plan. The cost methodologies were very different. There were some cases where they did look at the ingredients, the inputs, the facilities, the personnel, everything that goes into a specific task. In other places, it was, this is how much that project cost last year, so that's how much we think it's going to cost this year. And in some cases, within one country, you would have these different approaches from different sectors. So every sector is contributing in a different way. So even when you're looking at how is that money distributed across the country, that doesn't necessarily reflect the reality, because each ministry is budgeting in a different way. The cost estimation, some countries were looking purely at, okay, how much, if we were really going to do this right, how much is this going to cost? Where does the money come from? Or are we looking at these big inputs? Some of them, they're taking the numbers from budgets. So it's what they already spent, which might not reflect what it actually costs to perform the intervention. And then others, they're looking at other countries, for example. So I'm implementing a new program. I don't know how much that's going to cost. I don't really know what the inputs are, but I do know that this country did it and it cost them this much, and that goes into the budget. So these are all the variation that you see across. Next slide. So our aggregated cost tool, we were looking at what are all the components that go into these plans. And this included the very specific vitamin A capsules, food supplementation. But we're also looking at all the nutrition-sensitive areas. We're looking at healthcare. We're looking at poverty reduction. We're looking at women's empowerment. And then we're also, next slide, we're also looking at the governance, how to put those pieces together. In one place we went in and they realized that they spent a lot of time talking about the common results framework of nutrition-sensitive approaches, and they had a plan for that, and they had a plan for specific, and they realized they had zero budget for governance. So you're trying to put together the multi-sectoral approach without actually having anybody talk to each other. That became, and they added in, that was Sierra Leone, they put in a framework for governance of the sectors and of the development community. Next slide. So this is, I can't really see the countries, but these are the 20 countries that we looked at who submitted their costed plans. You'll see that there's incredible variation in where this is all in percentages. And so in relation to what types of things that are being planned for in these nutrition plans. And at the very far left over here in the mean, you've got a lot of the nutrition specific, right? And then over here, as Bangladesh, we're back into the nutrition sensitive. Bangladesh, Sierra Leone, Uganda, Nepal, and Indonesia are all looking at, they don't have a single nutrition plan. These are multiple plans in multiple places. So a lot of these things you'll see where the nutrition sensitive is very high, it's because they're incorporating the water sanitation, and that's a really big portion of what it is, of what's in their combined plan. Places that are more nutrition specific tend to have more still a crisis mode. But you can see the span of activities that does reflect what's happening on the ground in the country. Next slide. So in all of the plans where we look over this 5-year time frame, we're looking at $4 billion. So that's the commitment we got in June 8th, right? Most of that's going towards good nutrition practice, which is infant, children, and we're also looking at breastfeeding, and then there's the acute malnutrition. The total annual is about $1.1 billion, and the average annual, when you don't consider the countries that don't contribute or haven't put anything into the plan for specific actions, or the highest one, it's about 235 or just about 231 million annually per country on average. Next slide. Just a breakdown of where this is going. Most of the plan budgets are going towards good nutrition practices. The maternal and IYCF also includes advocacy and implementation of key legislation to support different activities and education. So the nutrient-dense diet is actually a category that we added on specific countries. When we were thinking in terms of supplementation, it was really into the nutrition-specific or nutrition-sensitive area. And the countries we're doing very specific actions towards adding nutrients to food. And so there are 3 countries. Mozambique was one. The other 2 they'll show in the slide. Who said, no, we have these very specific programs, and we want to include that. There was the discussion about what is nutrition specific versus nutrition sensitive. has been ongoing, and a lot of the back and forth we have had with these countries is how do we classify these different areas. There's a tendency to want to put things into nutrition specific because those tend to have easier targets to measure, shorter turnaround, so it's easier to get donors excited about something where they can see results more quickly, right? We say we're going to supplement food, you can see that in a shorter time frame. We say we're going to increase hygiene and going to reduce disease and diarrhea, and in 20 years you're going to see that these kids are taller and smarter, and that's a harder thing to measure over a longer period of time, and there's more pieces involved, and in some ways it's harder to tell. And so the countries themselves are trying to say, well, how do we set these priorities, and how do we map out how do we put this budget to show that we are really putting a lot of effort into these specific interventions. But there's been a big push towards the nutrition sensitive, because you can't, once you go in and you take care of these problems that are at the forefront, you still need to sustain, right? So they need to have the backbone, the nutrition sensitive component. And the big question is, what is the nutrition sensitive component, and how far removed can you go before it no longer is really nutrition sensitive? And what goes in the plan, what doesn't go in the plan? That was something that came up a lot during the global gathering. Is they really want some support around how do we define what is a nutrition sensitive approach that belongs in a nutrition plan, and how far removed, how many levels are there before you're no longer talking about the nutrition arena. Next slide. So just looking at the specific nutrition actions, there's a lot of variation. It really depends a lot on what's going on the ground in the country. Next slide. The nutrition sensitive approaches. The total over the 5 years was about almost 30 billion, and that was largely driven by Bangladesh. They have a huge nutrition sensitive component in their budget. So excluding, if you take out the highest ones, the nutrition sensitive, and the ones that don't have any nutrition sensitive, the average per country is about 1.3 billion per year. So nutrition sensitive, we have 3 basic categories. There's the food system, which is availability and accessibility. Interventions for enhancing care environments, that could be women's empowerment. That was a very, very small component of most of these plans. And then there's public health services, reproductive services, that's water sanitation. Next slide. So when you're just looking at availability and accessibility, the plans were pretty much evenly divided in both. So we had things like food feeding, and we also had food quality, agriculture, education. It's fairly well divided. Next slide. Looking at the food system, we have the divide between availability and accessibility. There's also that supplementary feeding, and then the reason you've got that big old red bar in Nepal is because they don't distinguish as one big block of programs. But you can see that there's a huge availability push towards availability of food. But they're really trying to find useful guidance on the range of activities that can be included in all of these. There's a lot of variation in what kinds of things are going into these plans, and not a lot of standardization about what might be included. Next slide. So just to give an idea of what kinds of things we're talking about when we're talking about these nutrition sensitive approaches. We talked to the ministries, to the donors about how this is where the common results framework really comes in, is in these nutrition sensitive approaches, because you're talking about a system of intervention. And as you can see from this slide, There's different examples of what contributes to these programs and where that might fall under the different ministries. So when you're talking about nutrient-dense diet, you're not talking about agriculture, you're not talking about health, you're really talking about a combination of activities over multi-sectors. And so this is where we start talking about this multi-sectoral feeding into efficiencies, which so far is quite lacking in a lot of these plans. You have, this is what health is doing, this is what WASH is doing, this is what education is doing. But when you look at the system actually has contributions from all of them. And so there's now starting the discussions about, well, how does what I do feed into what you do, and where are we duplicating efforts, and where can we make these things stronger by sharing the resources and the planning. Next slide. The same basics. Okay, you're done. Same idea when you're talking about fortified foods. You've got a lot of different sectors who are all feeding into this nutrition-centered approach. So that's one of the directions the discussion is going right now. Next slide. So aside from the accessibility of the food systems, accessibility, availability, there's also care environments. Care environments, as I said, are a very, very, very small portion of a couple of countries' plans. There's a public health component, which is non-communicable diseases, that's in question plans, and also just building up the system for sanitation and hygiene. The last category in this aggregated cost pool, aside from the nutrition-specific and nutrition-sensitive, next slide, is the governance component. And that tends to be the one that's not budgeted so highly, partly because of this idea that we're already doing it, so that's not part of the nutrition plan, that's part of our absorbed plan. And part because they're still trying to figure out how these systems come together, who's leading it, and how do we coordinate them. But the governance includes capacity building at the national level, but system-wide capacity building, coordination of the efforts, the meetings, the planning meetings, bringing the external funders in, and then policy development, marketing, advertising to a wider audience, to the individuals. So what is healthy? How long should you breastfeed? These sort of national media campaigns fall into this category. On average, if you get rid of the zeros and the highest numbers, the governments are planning about $27 million per year for government. Next slide. So just a snapshot of the things that are going into it: capacity building, coordination, monitoring meetings. Another big request is we've got so many indicators going into all of these different types of interventions. What indicators can we use that we can collect fairly frequently, not every 4 years, but to be on top of what's in it, and also where it's not such a burden. So they're looking for give us the top 10 indicators that are going to show us that the plans are moving forward and that something is happening. And so there's discussions around monitoring and evaluation and how that information is being set up from the district level. But also the stakeholder mapping that's included in the governance. What are the donors doing? How are the donors involved? And where is that money going? Next slide. So overall, we've got, of the 3 areas, we've got most of the planned costs are going into this nutrition-sensitive approach because we're talking about building water systems, sanitation, hygiene. That's really the large portion of those nutrition-sensitive planned costs. Government, when we first started looking at these plans, the small component is growing. And then the nutrition-specific really tends to be about what the on-the-ground conditions are, if there's a crisis, if there's, what the main issues are in each country. Next slide. So what did we learn? We went to a number of diverse places, and we heard a lot of different things about what worked. and what didn't work, and where they needed support. What we heard was, in order to make the nutrition message happen, it really has to be coming from a very, very high level. And that means that it has to be coordinated. We're talking about multi-sectors, we're talking about donors, we're talking about international communities, we're talking about citizens. I mean, it has to be a very high level, country planned effort. That nutrition has to be, having a sun focal point, having a champion of nutrition there spreading the message and who is at a high level has really helped in moving a lot of these forward. If the plan is going to work, the countries where the international communities of donors, the ministries were all planning together and talking about what goes into the common results framework and who can contribute. If that started from the beginning, those plans were much more successful than if the country came out with a plan and then tried to piece in where partners fall. It also helps a little bit with the buy-in from the different players. Everybody felt like they had a say in what was important and where the money was distributed and how their piece of it fed into the outcome. You had much more ground support. They found that using this aggregate cost tool helped them a lot to discuss the way the different ministries and donors contributed to this common results framework, and that it helped them advocate for domestic funding. And through that, once you show that you have this domestic commitment, that helps to leverage some international funding. Next slide. There was a lot of discussion about what happens next. Right? We have $4 billion sitting there. We have a financial mapping system. How does it get to the country, and once it gets to the country, how does it get to where it needs to go? There's a very big groundswell within countries for coming up with a full funding mechanism. So they say, here's our plan, here are our priorities. As the money comes in, it goes to one central place and then goes to the priorities that were set by all of the people who went into building the plan. It happened, there's one country where there is a full mechanism. Do you know what that was? Let me see. It'll come to me. And it seems to be working, but there's trust issues on both sides. There's priorities. I mean, the priorities have to be mapped out. So there's a lot of things to be worked out on how that money is going to get to where it needs to go. But in order to get there, the plan has to be well developed and say, here's what we have, here's what we need, and here's where it's going to go. And the countries are all at different stages on that. Well, the planning needs to be coordinated at a national level. The costing is much more successful if you start at the district level. So that's the message that I'm hearing right now is, yeah, we have this national plan, great. We distribute the money, it goes to the regional level, then that gets distributed to the district level, and that gets distributed to the villages, and then we don't know where it goes. And so how do we get the district or the villages to talk about what they really need? How do we get it to the right places, and how do we look at the accountability from that? Next slide. So this is where we are right now. We have a kind of big idea about what's going on, which countries are doing what, where, how the donor communities are involved in the different planning activities. And now we're getting more into the what can we do to move this forward stage. And so what the request I've been hearing, and a lot of what I heard at the global gathering was, we've got our plan, we need help costing. There's a lack of capacity within countries to try to come up with what are the costs that go in there. And there's still a lot of discussion about what is the best way to do that. There is no standardized cost method. So that's, it's one of the reasons you see so much variation across these plans. But the countries are asking for support, especially at that level, to try to figure out how to bring that information forward. How to decentralize. Advocacy is a big issue. Like, okay, well, we're all bought in at the national level, but we need to get people to change their behavior. How are we going to advocate to our districts and to the people who are going to help make this happen? But also, how do we get our message out to the donors? Say, look, we know what we're doing, and we have a plan, and we have these priorities, and we need help, and here's where we need help. And to be able to express where they need the help, as opposed to having the help just come and fit in wherever it fits in. So it's just a little bit more coordination with the donor community. A big ask that I heard, and what was very helpful at the global gathering, was the countries sharing experiences. Where did I run into trouble? How did I overcome that? Or if I didn't, how can we share information across countries? Because they're all, we've got 42 countries in the Sun movement right now, and they're all going through these experiences, and there's no reason they should be in isolation. So being able to sit in the room together and talk about their experiences has been very helpful for some. And I know that in Connolly, going to we're as an extension to the effort, because phase 2 and phase 3 have a gap. We've actually been working, ICF has been working a lot with, we've gone to Burundi and helped them with their enemy framework and the costing of the plan. We're talking to Mali, and Mali had gone into the workshops in Burundi, but how are you doing this? How is this going to work? So there are discussions, especially among regional networks, where they are helping each other. And then the next piece is, especially when you're talking about nutrition-sensitive approaches, what works? What evidence do we have that these types of things, if you're really going to be talking about a 20-year change, right, you do something now that's going to affect us 20 years down the road, what evidence do we have that that's actually going to happen? And so they would really like to see if the Sun movement supports research that will help them convey, this will work because, we've seen it in other countries, or there's academic evidence that supports that this is a good way to go, as opposed to just putting things in because they've always done that, or because in other countries they want more evidence, research supported evidence. I think that's it. Is there a next slide? All right, so phase 3 is very specific in some ways, and very, very vague in many others about what's happening next. We're going to continue with the policy plan reviews. Like with the original phase 2, we looked at 20 countries, now we're up to 42 Sun countries. So we'll extend this analysis and put the other 22 countries into this global framework. The supporting effective nutrition-sensitive implementation around a common results framework, that feeds into the research-based evidence. What common results are we looking for, and how do we get there? Which sectors need to be involved in order to move that forward, and what's the most efficient way to do that? Financial tracking and cost analysis are all things that the countries have asked support for, and then just working with lessons learned, trying to disseminate across the different networks what's happened, what's working, how can we move this forward, and just supporting the Sun Movement Secretariat in any way that they ask in terms of either these high-level meetings or going into regional meetings or specific country requests. Phase 3. I'm overlooping. So I'm going to start with some questions in the room, and then I believe we'll go to a couple on Sun.
Thank you. This is really terrific for all that you've been doing and have yet to come. Jennifer Rigg with 1,000 Days. I have a few questions. First, would you mind sharing a little bit more about, you mentioned breastfeeding in particular. Do you have a sense, I know it might be an estimate, as to how much is currently being spent on breastfeeding just in the countries that you looked at and how much is needed? As you know, there's a breastfeeding advocacy push that WHO, UNICEF, and others are leading on, and so that type of information would be extraordinarily helpful. And then secondly, as you're looking and expanding to 42 sun countries, and of course, new sun countries potentially to be added as the year goes on, I saw just on an earlier slide a mention of India. What are your plans for high-burden non-sun countries, such as India, and also as we're doing the road to Rio, if you will, and given the Brazilian government's commitment in June and then also last week at the Sun Global Gathering to hold high-level nutrition events, not just around the 2016 Olympics, but also now thinking about a few short months away in June at the Men's World Cup. If you have any sort of recommendations for those of us that are doing advocacy for what benchmarks might be ready by 2014 and 2016. Work that you're doing is extraordinary. What do you think, how close are we, or what do you, based on your experience working on HIV/AIDS and other issues, what do you think would help the Sun movement look at peer-reviewed or vetted plans and costing? And in some way, for example, some of the work that you've done, I don't know if you have any plans to publish it, that could be a great step there. And I'm sorry, that's way too many questions. But do you have a sense as well across the national contributions, what percentage across budgets, is currently being spent or planned for nutrition?
That one.
Great.
We can talk about it. I do not have the answer, but we can talk about it. On these two-page documents that are will be posted on the Sun website, two of them right now, Sierra Leone and Kenya are up. We have capital spending in different areas, and the plan is to add that specifically. How much of the national budget is going towards this national plan? There's a lot of interest at the global gathering to try to get an idea to be able to say, okay, we're only spending this much, and it was really an internal advocacy issue to be able to say, we're only spending 1/10 of 1% on nutrition. Whereas this country over here is spending 5%, and so we really need to step up. So we are going to be adding that to the pages. The breastfeeding, we do have that information, and I can probably figure it to you afterwards. Breastfeeding shows up in almost every plan. Where it doesn't, I would say not because it was excluded, but because it was lumped into a very large category, so we couldn't isolate it. But those are being refined. So I expect that if they go down to a more decentralized level, we'll be getting information about it. Non-Sun countries. So the Sun Movement Secretariat, they are not set up to support non-Sun countries. A lot of this peer evaluation review discussion, they are trying to bring in wherever they can. So there's no in-country support, but when there are discussions with many countries, there's no harm adding a couple of additional countries, and they're doing that as much as possible, because not only do they still have things to learn, but the countries in the Sun Movement can learn from the countries that are not as well. And so there's a lot of discussion about how do we involve all the players. We even talked about putting together 2 pages for the U.S. What's the nutrition plan in the U.S.? To just get an idea of what is the sort of global movement, what is it across the world. And then we had one other peer-reviewed publication. We are actually actively discussing how to at least come up with a first cut framework for looking at the effectiveness of interventions and the pathways for success. The Sun Movement Secretariat has already contracted the Columbia University to do a very, very thorough literature review, bringing in everything evidence-based they possibly can on nutrition-sensitive activities. I've been talking with talk to you, the director of some events about how we can map those into the specific tasks in the budget, so this is the plan, right? And so even, I envision that the first cut will have a lot of, but we have, if we can map out pathways and have, 3 out of 4 have some sort of evidence-based connection, with another, with the board having a range of probability of success, we can at least come up with a baseline, a place to start. And then it will also, we hope, show where we still need work on developing the evidence, where we're missing information. So that is in order. We're going to do that online. Because you have all your questions.
Can you hear me online? I hope so. I will give you a response. Okay, the first question was from Steve Volt. He wants to know if there's any reference for the ACT, the aggregated costing tool.
It is online on the Sun Movement Secretariat's website. We'll publish reference now.
And then the second question is still from Steve. He says, can you say a bit more about the specific monitoring and evaluation activities that are proposed?
That varies within countries a lot. There's been discussions in the different places that we've been that vary from having somebody from the National Statistics Office go and collect information on specific indicators to building into plans that already exist or monitoring plans within the health system. So a lot of these indicators are going to be health related, so trying to build them into some sort of clinic setting makes sense, but also within the education system. The overwhelming desire is to have this information at the district or the local level. The real question is, how do you coordinate that in a meaningful and timely way? And that part, I don't think anybody has come up with a solution that is still grappling. There are countries that have more well-developed systems, and I'm thinking Indonesia has a huge collection capability, and what they have are a whole bunch of indicators and they don't know what to do with them. They're looking at thousands, so which ones are important and how do we do that? So they're looking for guidance as to which ones to use. But I hope that answers your question. It's really very significantly. So do you have reports for all the countries? All of the country reports are on the Sun Movement Secretariat website. I don't have my phone.
Huge staff, congratulations on doing that. I was curious about a question about the process in terms of folks in the country. Would that be the Sun designated leader for that country you all started to dialogue and coordinated with that individual that
Yes.
level of ownership?
In order to become a Sun country, you have to show initiative through designating a focal point who will be that contact person between who coordinates at the local level, but then also coordinates at the time.
So that, in this case, that was who had a group in targeted to the dialogue track. The other question was, you said there was a lot of requests for PA around costing, especially money. Would that be seen as a government type of activity in terms of building local capacity down at the district level, or how that might be defined and what areas that might go into? Because I would personally say it's very much the governance initiative, strengthening at the district level, where on it would be an interesting case to follow in terms of leading the way, but I was wondering what the thoughts of the group on that in terms of the GA that might go for economy and business project.
I have not specifically seen in any plan the plan cost of costing out things at the district level, but I would agree it's a governance issue because that is with the coordination of different sectors.
I was curious in terms of a lot of this, how you decide this in terms of the invasiveness of nutrition. It's a big path on nutrition-specific say how far you change it, how far you depend on the various animals, how those things are thought about. This is a process to try to define that.
Yeah, in a lot of cases, the structures are in place for other systems. So I would say it doesn't get included. It's one of those excluded categories because it's already absorbed into the system. So I'm not sure that they. So, like I said, I've not seen a specific line item in any plan that talks about, developing a cost. It's really more about coordination.
It could be some ways of discussion in terms of being able to set it up in terms of what's needed there, because it sounds like this is above and beyond that which is already programmed.
Right, and that's
already been asked.
Right, so the issue is these kinds of things are outside of what we've been looking at in terms of the cost of the plan. And I would say that that's probably, in my eyes, one of the biggest issues in the cost of the plan is these excluded categories. So we can look all we want at how much we're doing on, what's nutrition specific versus sensitive, but these absorbed costs, the personnel who are already performing duties at the health district level who are actually doing nutrition tasks, and the costing process, especially if it's already been incorporated into the national planning process and is not being included as an additional nutrition expense, those are being included. Right. And some of the discussions we've been having is, if you want to be talking about showing the national commitment, then you want to be including as much as you possibly can to show, look, we've done this, this is all part of it, and put those costs into the plan so that it becomes more obvious how much of an effort you're putting in and how much the country's committed. So that's a change, the shift that I'm seeing.
Another online. Other art. Two questions. I was wondering, you touched a little bit on the results framework, the common results framework, and I know that that's phase 3, like the SUN initiative, but I would argue that it actually should be phase 1, because I think that you should start from the common results framework and then plan your national nutrition strategy and implementation plan and costing from that. So I was wondering, so the countries that you work with, the 20 countries that you work with, do you find someone that has like a model, ideal results framework that they began with, that they contrast their targets and results from? So that's my first question. And then 2, I was wondering about the cost categories, because you didn't really show the categories that you guys came up with. So I'd be very interested to know those categories and how those were vetted in like the process that you guys did with if it was like with the countries to decide like what were the cost categories and how were those, and like maybe which ones were left out and whatnot. And then I was a little bit curious, the third question was curious about the nutrition sensitive. Some of your categorization, like for example you had some malaria, I think I saw in there, for example, and one could argue maybe that ICANN could actually be nutrition specific, for example, because of like the Lancet evidence and stuff like that. So I was just kind of wondering how you guys came up with those differentiating nutrition specific and nutrition sensitive, and what that process was about.
So your first question was about common results framework. I probably presented that poorly. What we're doing now is we're going back and enforcing what is already story there. Each one of them kind of started with that sort of concept. What is it they're trying to go for? And if you look at most of the plans, they're very geared towards these strategic objectives. The issue that we're grappling with in phase 3 is more looking at the evidence to support the types of activities that are going into the common scope framework, not building a common scope. So I think we looked at it are pretty dense on that phase.
Absolutely. I looked at a lot of them too, and I just noticed that a lot of them, the results frameworks are very varying in quality. Like some of them actually use the proper strategic objectives, intermediate results, and then like lower inputs and outputs, but a lot of them have it all confused and it's kind of all over the place. So I was wondering what your experience was with that, like there's the varying levels of quality of the results framework.
I would say that that's changing. I mean, I think part of this communication that's happening right now is, okay, all of these plans have been developed in isolation. Now we're talking about it, what common results framework is this country using, how do we, as we talk about what are the nutrition sensitive approaches, I'm seeing adjustments in the way that things are framed. So we think it's an ongoing effort, but I've seen positive movement. As for the classification, so we have the 3 big nutrition sensitive, nutrition specific governance. The individual classifications underneath those, you can also find those on the Sun Movement Secretary website, the whole framework. This is where I am not as informed. I'm doing my math this one. So we worked with nutritionists through HPI to help develop the categorization. The first step was to discuss each of the classifications first with the Sun Movement Secretariat, with the lead group from the Sun Movement, and then as we incorporated the plans into the framework, then we went back to the country and said, okay, this is what we thought. And so there was a lot of adjustment that happened over the couple-month period where we started agreeing on what where. There was no discussion, as far as I know, around looking at the non-communicable diseases and moving that to the specific. That seems widely accepted in the sensitive.
Consider health.
Yeah, so it was more the public health. So.
And those are available on their course and the secretaries, like the costing categories and like the definitions.
Yes. All of those are, the whole framework, the discussion around it, that's all available on the Sun Movement Secretary website, as are the individual country visit reports. And there's also a report on the 21 as a whole. And then after her, right up front, trying really hard.
I have a more general question around methodology. I was curious. You mentioned that you did work in HIV costing before this. What were some of the differences that you noticed working in nutrition costing versus what you've been doing previously? I was just curious if you lessons learned from that switch.
In doing the HIV cost work, we were looking at treatment and prevention costs of a single individual for a year, and we were going in at the clinic level, and we were doing time use surveys, so finding out how much of your time was put towards this test that was yours. We were counting Q-tips. It was a very, very detailed discussion. It was all, we also had the which medications were being used, what regimens were, what the probability of certain regimens were, so that we were looking at pediatric patients versus adult patients. So it's very, very detailed. This is a lot of these costs are coming in from a top down rather than looking at that bottom up. But I'd say that's as these plans are being developed, we see that changing a lot. Because the first step was, okay, we have to get a plan. So, let's throw in, here's what we're going to do in this plan. Now we're starting to talk about implementing. And when you start talking about implementing, you have to talk about what goes into that. And when you start talking about what goes into that, then you really have to get more detailed about what the components are. So I would say it's building, but it is a very different level of costing.
Talk a little bit more about this
exercise for developing the plan? You mentioned that there was a huge variation between countries in terms of stakeholder engagement in developing the plan. And then moving forward, as countries are moving towards decentralization, will the capacity building of civil society be part of the need as and has there been any discussion of looking at the civil society alliances that currently exist in some countries and how we can strengthen their capacity?
Yes. I would say that really varies depending on who's involved in the other types of planning processes. So if you've got sort of a multi-sectoral approach towards budgeting, then you end up you bring in more players. I mean, so the more players who are involved in the general as they get more, plans get more and more decentralized, I see more and more players coming in. Because then they start figuring out, well, really, who is getting things done? How is it getting done? And so, the actors playing in as those things change. I would say I didn't see a lot of it at the national level, but I am seeing more of it as more. So the players are growing as we go down. So, which is why they're really stressing the importance of this district level planning, because in some cases it really is specific across, it changes across the district. So some districts is very important and others might not be. It might have to do with whether you're in a rural area, a remote area, or capital. So. But I would say from the sun movement perspective, the more players the better. And the involvement really is about getting as many people involved and engaged and part of making it work. So I would say yes.
I just want to bring this to close. We're done way over our time, and I just want to thank all of you. And I want to thank Tom for doing such a great presentation. So we were around here for a little while, so we had some
Let's glad to catch you and around New York back home now.
I will start